Am I the jerk for warning a nurse that she might pass out during a medical procedure? This actually happened 3 days ago, but today is my day off, so I have some time to write this down. I am a doctor in a hospital. One of the procedures we do is called a bone marrow biopsy. It is a procedure where we go inside the bone, where the factory of all blood cells is, and get a sample. It's done in the room at the bedside. No need for an operating room or anything. We usually use a special needle to get into the hip bone from behind as the patient is lying flat on their face. It sounds scary, but it's a fairly minor procedure. It takes about 20 to 30 minutes. Today I had to do this for one of my patients. Usually I require some assistance, someone to hand me things when I am sterile and to take things from me. Anyone can do it. Usually I have an eager medical student and I explain what I am doing as I go so he or she can learn. Today I didn't. So I asked for help from one of the nurses and they gave me one of the travelers who are there to help. While I am preparing the field and getting ready, I said how thankful I was for her to come and help. I had never seen her before, and I know the floor nurses fairly well at this point. That's when she told me she is a traveler. I asked if she ever saw a bone marrow biopsy before, and she said no. I then asked if she had lunch, and she said no. So I decided it was a good idea to warn her. I said something like, hey, just a heads up, a lot of people seeing this for the first time get a little woozy, so if you start feeling it, let me know. And it's true. I have had a few nurses, med students get woozy while watching. Something about the needle pushing through the bone that gets to people. There is a scratching noise that you can audibly hear as the needle rubs against the surface of a bone. People feel it in their core. It's also a very forceful procedure. Bones are hard and I have to apply a great deal of pressure to make my way in there. And also the fact that when we pull out the marrow, we are technically pulling fluid out of a vacuum, and that can sometimes be painful to the patient and the viewers to behold. Boy oh boy did she not like that. She rolled her eyes and huffed and puffed at me and said,
"Don't you worry about that, honey,"
with the full weight of the condescension that honey can carry.
"I've been a nurse for 15 years. I've been a trauma and ER nurse for most of it. I have seen metal spikes and machetes pulled out of all sort of holes on patients' bodies. I think I'll be all right."
She was intentionally rude and antagonistic. I stopped for a second and looked at her, trying to decide how to respond. But after a split second, I decided it wasn't worth it. I'm not a confrontational person normally, and I've been around long enough to know that it's not worth it to engage. So I just said, okay. I genuinely didn't really care. I just wanted to finish my procedure in peace and move on to the next patient during my very busy day. Well, what do you know? Minutes into the procedure, I got my needle into the bone marrow space and I am starting to pull out the liquid marrow. This is the painful part. The patient grunted and I apologized. Not much I can do about this part. All of a sudden, I hear a thud. I turned around to find said nurse on the ground out cold. I call her name. Nothing. This was obviously a problem. I had to leave my sterile field, interrupt the procedure, and get help. The other nurses called a rapid response, which is an overhead page that we typically call when a patient is looking suddenly ill, and we need extra hands. The nurse ended up in the emergency department. She is thankfully all right. This story is great because it takes a nurse who is absolutely rude and disrespectful, and it humbles them a little bit. I'm kind of glad this happened to them, only because I found out that they're actually all right at the end of it. Why would someone act like this when a doctor's trying to warn them ahead of time of something that might cause them anguish of some kind? I mean, that's just absolutely downright rude. The nurse in the story should be ashamed of themselves. And the doctor did the right thing of trying to give them as much information about something they've never seen before. And the doctor's not kidding. That bone marrow procedure is not nice to look at. So I don't blame him for trying to warn the nurse ahead of time.
The full version of this video is on the Am I the Jerk YouTube channel, so check the link in the description for it. And if there are any updates to this story, that's where they'll be. There is also a podcast version of this show on Spotify, Apple Music, or whatever you use. Just search Am I the Jerk. It's perfect for those of you guys that use Spotify or whatever platform you want to listen to podcasts while you're driving or on the bus or drawing or planning to take over the world. So go check out the Am I the Jerk and Am I the Genius podcasts on any of those platforms.